There was one thing that I do have to say about the difference, I think, in our group and Franklin, is that they didn't have their nonprofits involved. We do, all around this room. However, we have a lot of different partnerships that all work together to bring about health care as well as other needs to these people, and also think about it from the standpoint of the people that we see. Some of them used to be donors of ours. Now, think about that in Fayette County. The criteria for being seen at Fayette Care Clinic is that you must be, number one, a resident, number two, you are low income, and you are totally uninsured. We provide access to health care, and this is, to me, I always usually say true access to health care, because I'm not sure what access to a Medicaid card is going to get us in the future. I think Michael's told us a little bit about that, and you've seen the numbers. We firmly believe that our numbers are going to double. So we provide access to health care to our residents, and we do that with 3 staff positions and 140 volunteers. Our physicians come in there, our providers, dental and all, and I'll show you what we do in-house in just a minute, are all volunteers within our community. In-house, we provide, and this is what I'm so proud of, because if you look at most clinics around the state, and we have like 82 around the state, you will notice that they usually have primary medical and maybe dental, but for the most part, they do not have all these specialties in-house. We actually see patients in Fayette Care Clinic for all of these issues: primary medical, dental, vision, physical therapy, dermatology, cardiology, diabetic education, prescription assistance, referrals then to our other specialty groups, and we have intern-externship programs. And I do want that known around this room, because we provide a place for people that are going to school, whether it's for nursing or doctors, whatever. You have a place where you can do your rotation through Fayette Care Clinic. That is one of the ways that I feel like we give back. When you look around, most of the time when a nonprofit person's coming in the door, everybody scatters because they think we're looking for money, and we are. I mean, we need that too. But we also provide something back to our community. And if you talk with us and get some of us together, like Becky, my buddy back there, you get some of us together, you'll see there's a lot that we provide back to this community, and we are love and are passionate about our county. The other thing that I want to say is in 2013, our newest will be GYN with Thanks to Leonard, and that came from being on the bus. Now, we have other community partners, and I'm calling this community partners, and then the next slide I'll go into monetary, but some of these go across the lines. But let me say this. We have Piedmont Fayette Hospital, and these partners on this screen now have been with us since we began. They provide in-kind services to our patients. Piedmont provides currently right now, they provide laboratories and all of our mammography. And we're in discussions about other things that we're going to provide in the future, but we also have another very important thing, especially for us and for this county, is tracking of data. You heard Michael talk about the ER being up. We didn't start tracking readmissions, but now like a month ago we had a meeting, and I think it was John and Michael both that brought up the fact that we got to start looking at readmissions. Well, I went back to the office and said, okay, we got another one to add in. We know that we reduce the ER visits, and we can show you how. And the hospital also supports that because they provide us the data on our patients to turn around and say, we kept these patients out of your ER. So we also have OPI, which provides us our radiology, Ankle and Foot Centers of Georgia. He's also on the board. If you notice, I get some of these people on the board too. But he deals with all of our diabetic issues for feet, and if you know anything about diabetes, there's always a foot problem. So Georgia Charitable Care Network is the network that across the state that all of the nonprofits, we don't literally, not nonprofits, I'm sorry, all of the clinics. We don't literally report to them, but they provide us a very beneficial service, which is a lot of education that we obtain from them, but we also obtain some other things that are very important. Legislative issues. How does healthcare reform impact the clinics, and how does it impact the communities and the health of everybody, and then how do we fill that gap? If you remember, you probably heard a lot about gap filling when clinics started opening. We're going to fill this gap. Well, the gap was small then, or I thought it was. It is certainly getting a lot larger. Then we have Georgia Lions Lighthouse, which provides vision for us, along with Dr. Nancy Barr from the community. We have the Fayette County Chamber, which I am very proud of, and I know Virginia's happy for me to say that, because I've been one of those that's complained for several years about, I don't know where we fit. And I didn't, because exactly what I tell you a while ago. We are a nonprofit. We walk in the door, and people want to scatter because they know we want money. Virginia finally let me see that. So, and then Central Education Center. We have been working with the CEC for years. That is the work-based program in Coweta, and I am so pleased to be involved with Kim on our new academy in Fayette County. These are our monetary partners. Now, again, some of these partners, and they've been here for a while as well, but some of these partners also do in-kind services with us. But we've got Community Foundation of Greater Atlanta, who's provided us dollars for years. Healthcare Georgia Foundation, we just received an award. I think Kim will tell you about that in a little bit. Kaiser Permanente, who I adore, have been with us forever and continue to support us. We actually started a group that has Kaiser sitting in the room and the hospital sitting in the room and working with us to discuss how do we do other things together and join together and do better. That's another thing called collaborative. Everybody likes to use that word? Okay. Clothes Less Traveled, that is the best nonprofit I have ever seen that knows exactly what to do with their money. Because they bring stuff in, they sell it, and then they give the money back to the community. And we have been a recipient of that money since we have opened. American Medical Association Foundation, Georgia Power. Thank you, Georgia Power. There's Georgia Power. Georgia Power not only has provided us funding every year, Georgia Power has provided us, and y'all may not even know this, furniture at times. And MLK Day always is Georgia Power Group is at our office doing whatever we like. This year will be painting. So it's always a blessing to have our Georgia Power people with us. And then we have United Way, who's provided us funding for since we've been started as well. All right, I'm back to Franklin. Y'all, I am so excited about this thing. It is so wonderful to be involved in it, but to also know that this whole room has an opportunity to be involved in making our county the best place it can be. Now, I already talked to you about Leonard, but there's a career academy. I said something about Kim, too. Local public officials. You know, as a nonprofit, you really don't get in front of them. I mean, let's face it. But this county has opened up, and they are coming to my office. I have had every single commissioner-elect, just about the governors, walking in the door. And I'm having fun with this. Of course, Trey told me about a year ago I had to get involved in politics. And I said, not me. But I did. We also had another thing that came out of when we were in Franklin. A comment was made, and I thought it was a great comment. If you take the young professionals that are in our chambers and give them an opportunity to sit on a board, if we do that, they'll understand how boards work, probably help us work them even a little bit more efficiently. So we turned around and I took that when we got back, and I made the first phone call I made when I got back was to a young professional in Brooke Eason, and who is now currently on our board. Now, the other thing, if y'all decide to do this with me, and I hope you do, is we decided that you give them no voting rights, but they also don't have to pay to sit on your board. So for the rest of you who'd like to sit on my board, I'd love to have you. And then we strengthen these long-term relationships with the chamber, with our friends, with the hospital, and with our other partners to say, look, we're really going to make a difference here in this community. And we thank you for that. And I thank y'all for the opportunity.